Washington hospitals are struggling statewide. The Washington State Hospital Association says bed availability and other services are being affected. Our Bronte Saratsky spoke with Providence Spokane about what this means for people in need of care.
Washington hospitals like Providence are struggling. Costs are going up, but they say they're not making any more money.
I have been in healthcare for nearly 40 years, and I have never seen a financial crisis in healthcare the way we have currently.
Providence's chief executive, Susan Stacey, says what Washington hospitals have dealt with lately is unlike anything they've dealt with before.
We are dealing with a workforce shortage, high salaries, our wages are higher than ever before, like many industries. And then we also have travelers and temporary staff that are at significant increased costs than what we've had.
Stacey says they've dealt with it since the beginning of the year, but now costs are really adding up. An added challenge, patients who have stayed for long periods of time but cannot be discharged due to lack of availability at post-acute care facilities.
Just here in Spokane, just at Sacred Heart and Holy Family, we're close to 100 patients who are sitting in a hospital bed who do not need hospital level care.
One patient had to wait at their hospital for over a year, just waiting for a bed at another post-care facility.
We recently discharged a patient just a couple of weeks ago who had been in the hospital over 400 days. That's over a year waiting in the hospital. That's not only not good for the healthcare system, but it's really hard for the patient who is stuck in a hospital bed.
And if you are a patient needing to go to the emergency room, you could have to wait hours to receive care. In Spokane, Bronte Saratsky, 4 News Now.